Dear participants of the Third World Traditional Medicine Forum, I would like to thank the committee for sending me this invitation to present you my knowledge today. My name is Dr. Ioannis Dimitriou. I'm the main researcher of this research, which is a randomized controlled trial for assessing the efficacy of acupuncture on emotion of stress and quality of life. This research was undertaken from the National and Capodistrian University of Athens. The research committee is made from Professor George Krousos and Professor Haralabos Papageorgiou. I would like to thank them, of course, and the person who did the statistic analysis, Ms. Vicky Efthimiou. This research took place during 2020 to 2021. Just to introduce myself briefly, as you can see, I have been studying in China for quite a few years. I'm a medical doctor, and at the moment I'm doing my master's degree in mental health promotion and mental illness prevention. So this research that I'm presenting you today, it's part of my master's degree. Actually, it's my second master's degree. First master's degree, as you can see, it was in acupuncture in Tianjin, China. So this is the abstract of my thesis and of this research. The objective is to investigate the effectiveness of the intervention of a specific new acupuncture protocol in stress reduction. The method, the intervention was applied in the area of acupuncture point Do24, Senting, for 25 minutes at a time, 2 times per week for 10 sessions. 10 people participated in the intervention group and 10 people in the control group. The results were that there was a statistically significant difference between the intervention group and the control group in the perceived stress scale and in another questionnaire that measures the quality of life, the heart rate variability, and the cortisone mean. And the conclusion is that the acupuncture protocol with 3 subcutaneous needles in the area of the acupuncture point Do24 for 25 minutes at a time, 2 times a week for 10 sessions, is effective for improving the quality of life, reducing stress, and improving heart rate variability and cortisone levels. This is a video that we have made in my clinic in order to promote this study in the social media, and I can also describe a little bit the whole process. In fact, this study that I'm showing you now is half of the study that I have prepared for my university. So the initial study, I will start playing the video. Here we see a patient who is stressed that he is coming to my clinic. My clinic is called Yin Yang Clinic, and he is submitting a questionnaire. And if we find that he has stress, then we let him know about this. And then we apply 2 kinds of therapies. One therapy here on your left is the scalp acupuncture, and another therapy is the Fisher-Wallace device, we do electrostimulation on the brain. But basically this second part, we have not applied it yet. So I will talk to you more about it in a little while when I describe more about the initial study. So these are the two interventions. Sorry for this is a Greek video for the Greek people, so sorry for some Greek words here. So after doing 10 treatments, they would feel much better. This is what the video says. And in that way they will help the understanding of how acupuncture works. And of course this study is under the Medical University of Athens. And this is Professor Chrousos, and on your left Professor Charalabos Papageorgiou. Professor Chrousos is responsible for the master's degree of stress, and Professor Charalabos Papageorgiou is responsible for the University Hospital of Psychiatric Diseases, and for the master that I'm taking place. And this is me in my clinic. So as you can see here on your left, the initial study had 4 groups, one of acupuncture, another one of placebo acupuncture, one of Fischer-Walla stimulation, and one of placebo Fischer-Walla stimulation. But what we have performed and what I'm presenting you today, it's the acupuncture group versus placebo acupuncture. So some important study points. Firstly, as you can see on your right hand side, because on the left hand side is the diagram that I have given to my university. So in the beginning, the clients, they would do the registration. We would do the randomization, either in placebo or acupuncture group. We will collect the saliva before the first treatment, and we will do the measurement of the heart rate variability. We will give them the questionnaires to fulfill before the first treatment, and then the same things will be repeated on the second treatment. Here, for example, is the lab. This is another professor that is doing the measurements of the cortisol saliva. The patients would have to put their saliva in the morning and 1 hour after waking up, and another time during the evening to see how the cortisol measurements were changed during the day, this before and after. So all this scientific data was collected in the laboratories of Athens Medical University. The aims of this study is to see about the efficacy of the acupuncture, especially for treating stress, to create a new protocol which is easy to use, especially for medical doctors here in Greece that they do not know about acupuncture, so something that would be easy for them to use. Implementing ICD-11 from World Health Organization, it was also important. And some things about the design of the study. So we had 10 participants on the intervention of acupuncture group, and another 10 participants on the placebo acupuncture group. 9 of 10 patients completed on the acupuncture group, and 7 out of 10 completed on the placebo group. I repeat, this was a randomized single-blind study. These are the treatments that we had. We had 169 treatments, 91 acupuncture treatments, and 78 placebo treatments. I have to say that the protocol was approved by the Committee of the Master Degree of Promotion of Health, of Mental Health and Prevention of Psychiatric Diseases. Information was given to participants by myself about the aims and the procedure of the study. And there were some exclusion criteria. The age of the people had to be between 18 to 65. They would have to live in Greece. They would have to have a positive evaluation in stress. And of course, if they would orally take cortisol, then they would be excluded. And if they could not read or write in Greek or English, also they would be excluded. So, a few things about the intervention. 3 needles on DO24 scenting points were applied for 25 minutes, 2 times per week for 10 treatments. The placebo group were blindfolded, so in order for them to be relaxed, we have put them some blindfolds, so they were not able to see if they were taking the normal acupuncture or the placebo acupuncture. So they were blindfolded, and actually no acupuncture was applied to them, and they were lying down for 25 minutes, and they came twice a week for 10 treatments. For ethical reasons, after finishing this, we have provided normal acupuncture to them after the placebo finished. For the statistics, we have used mixed ANOVA and SPSS program. The level of statistical importance was 0.05%. And here are the results of the perceived stress scale. This is a questionnaire that the clients would do themselves, and we will get the results. So here you see a big difference. With the blue line you see the placebo, which basically remains the same, and the acupuncture treatment, which has a big drop. The p-value here is 0.002, so it is statistically important. These are the results of the healthy lifestyle and perceived control questionnaire. This is a questionnaire to understand the quality of life. And here you see that the quality of life of the acupuncture treatment has been increased, and in compare with the blue line of the placebo, which has decreased a little bit. The p-value is 0.008, so it is statistically important. Here is the heart rate variability. The heart rate variability was measured with a special device on the chest, and here with the red line you see before and after on the acupuncture group. You see an increase. This is a healthy thing if it is increased. On the blue line you see the placebo group, which has decreased a little bit. P-value is 0.16, so it is statistically important. And here we see the cortisol. This is the first measurement in the morning. We see there is a decrease, but the p-value is 0.17, so it is not statistically important. This is the morning plus 1 hour after the wake up. Here it is also not statistically important. And here we see the evening cortisol measurements, which is 0.3, which is also not statistically important. But if we see the cortisol measurements, the average results before and after, so morning versus evening, with the blue line we see an increase, and with the red line we see a big decrease. So the p-value is 0.042, which is statistically correct. So even so the conclusion is no matter if we have the questionnaires, which are the things that our clients have measured by themselves, they are understanding by themselves, no matter if it is the heart rate variability, which we have measured with special devices, or with the cortisol measurements, which is their chemistry, everything has changed with the use of these acupuncture points. The reason why I have thought of using this point, the 224 scenting point, is for two reasons. Because it is a point which has this name, Sen, we know it has to do with the spirit, and Ting means a hole, a place. So we know it is very important for the spirit. And in scalp acupuncture, we know that there is, according to the theory of holography, we know that in this front area, actually it's the brain. So if we regulate the brain, if we regulate the spirit, my idea was that we will have a good impact on stress. And of course, 3 needles can cover a bigger area, can have stronger stimulation. So the results would be better than 1. There were not any manipulations on the needles. They will be mainly put it inside and just remain there for 25 minutes. So these are some positive results I bring you from Athens, Greece. I thank you very much for your time. In case you want to contact me, ioannisdimitriou.com is my website if you want to know more about me, and info@ioannisdimitriou.com is my email. I send you my warm greetings from Athens, Greece, and I wish you best success.